Gavi. Officially Gavi, the Vaccine Alliance is a public-private global health partnership with the goal of increasing access to immunization in poor countries. Gavi facilitates vaccinations in developing countries by working with donor governments, the World Health Organization, UNICEF, the World Bank, the vaccine industry in both industrialized and developing countries, research and technical agencies, civil society, the Bill and Melinda Gates Foundation and other private philanthropists. Gavi has observer status at the World Health Assembly. Along with global health initiatives in general, Gavi was described as innovative, effective, and less bureaucratic than multilateral government institutions like the WHO. Gavi programs may produce quantified results within an election cycle, which is appealing to parties locked in an election cycle. One author described Gavi's approach to public health as business-oriented and technology-focused, using market-oriented measures and seeking quantifiable results. Gavi follows a model termed the Gates approach, or US-type approach. It contrasts with the approach typified by the Alma-Ata Declaration, which focuses on the effects of political, social, and cultural systems on health. In the 21st century, Gavi supports the immunization of almost half the world's children, giving it power to negotiate better prices for the world's poorest countries and remove the commercial risks that manufacturers faced in serving this market. It also provides funding to strengthen health systems and train health workers across the developing world. Gavi has helped immunize over 760 million children, preventing over 13 million deaths worldwide, helping increase diphtheria vaccine coverage in supported countries from 59% in 2000 to 81% in 2019, contributing to reducing child mortality by half. Gavi has been criticized for giving private donors more unilateral power to decide on global health goals, prioritizing new, expensive vaccines while putting less money and effort into expanding coverage of old, cheap ones, harming local healthcare systems, spending too much on subsidies to large, profitable pharmaceutical companies without reducing the prices of some vaccines, and its conflicts of interest in having vaccine manufacturers on its governance board. Gavi has taken steps to address some of these concerns. Gavi runs in 5-year funding cycles, which enables it to negotiate long-term deals with manufacturers, secure in the knowledge that funding will be available. Following the latest Global Vaccine Summit in June 2020 hosted in the UK, $8.8 billion was raised for the funding cycle 2021 to 2025, exceeding the target of $7.4 billion. This included $2 billion from the UK, $1.6 billion from the Gates Foundation and $1 billion from Norway. It is hoped that this round of funding will mean that 300 million more children in lower-income countries are immunized for diseases including measles, polio and diphtheria by the end of 2025. Additionally, the funding will support health systems to withstand the impact of coronavirus and maintain the infrastructure necessary to roll out a future COVID-19 vaccine on a global scale. In the period of 2016 to 2020, over which $9.3 billion United States dollars had been received by Gavi, the UK was the largest donor, providing around 25% of total funding, with the Bill and Melinda Gates Foundation, the US and Norway close behind. Industrialized countries are Gavi's principal donors, providing approximately 3/4 of the total funding. All donor governments are represented on the Gavi board through a constituency system. Gavi was created in 2000 as a successor to the Children's Vaccine Initiative, which had been launched in 1990. Gavi was awarded the 2019 Lasker Bloomberg Public Service Award for providing sustained access to childhood vaccines around the globe, thus saving millions of lives, and for highlighting the power of immunization to prevent disease. CEO Sate Berkley commented that the global response to the COVID-19 pandemic had started off remarkably well. However, he cautioned that there was a need for a coordination of production at a global level. He advocated that the pandemic needed a global response whereby the best global facilities for separate parts of the processes should then be integrated into a global process. He said he hoped that the G20 countries should work together with a budget of tens of billions of dollars, and that individual countries should be prepared for finished vaccines to be allocated according to greatest need. In September 2020, Gavi was announced as one of the organizations leading the COVAX vaccine allocation plan, created to ensure that any new COVID-19 vaccine would be shared equally between the world's richest and poorest countries. The following month, Gavi announced the approval of up to $150 million to help 92 low- and middle-income countries prepare for the delivery of future COVID-19 vaccines, including technical assistance and